In this video, I'm going to cover strategies for variable measurement. This doesn't touch on variable manipulation or the act of actually changing something about a variable as the researcher. Instead, this is just measuring sort of pre-existing values of the variable in your participants. So measurement strategies are broken down between a few basic types, the most simple and straightforward of which is your self-report. If you're looking to just gauge the extent to which any individual has a certain variable or expresses a certain variable, you can just ask questions to try and get their subjective sense of their own levels. So self-reported is what it sounds like. It's when people tell you what you want to know about themselves. So anytime there's any sort of scale to which participants are responding or they're writing narratives about themselves, any sort of interview strategy, that would count as a self-report measurement. Self-report is great. It's quite useful because it is straightforward, it's quite easy, it's quite inexpensive. If, for example, you're interested in depression, administering the Beck Depression Inventory as depicted here to the right is a really easy, straightforward way to do so. A key element of depression are your subjective feelings of sadness, of despondence, of feeling like a failure, of lack of pleasure. So the most straightforward way to get at someone's level of depression is to just ask them questions about themselves. Then what you're left with is individuals who have higher scores on the BDI have higher levels of depression. So you merely measure depression by trying to get people to produce the information that you're seeking. Obviously, any measurement approach is going to have upsides and downsides. So as I mentioned, the upsides of self-report is going to be its simplicity, it's cheap, it's easy, it's straightforward. The problems are that if you're dealing with a variable where participants are maybe not motivated to be perfectly honest or forthright, obviously asking people to produce the information that you want is going to be kind of difficult. Let's say it's a variable like prejudice or discrimination. People are typically loath to admit that they have those pernicious feelings or that they have prejudices or that they are racist, even if it's true. So if it's a variable that you know people are going to not want to be completely forthcoming, self-report is obviously going to have a pretty strong limitation there. So in deciding whether or not self-report is the strategy that is best for any particular research scenario, it's a question of trying to assess whether or not you have the capability to do anything more advanced, and if you are in any way concerned that participants might be inclined to lie to you. In that case, then self-report is obviously going to have that limitation. There's other measurement strategies besides self-report because, again, a key limitation to self-report is that maybe people don't want to be completely honest, or maybe people don't necessarily know or have access to all of their subjective feelings. So obviously it's not perfect. So the other options that we have, one is the measurement approach of observation. So this is when the researcher merely takes data collections by observing any human or animal participant in some environment. Now, observation is going to be a great first step to try and get a handle on a situation. You are obviously not manipulating anything about the environment or manipulating any variable, but you can get a sort of a great sense of what naturally your participants do. So it's a good first step in trying to understand whatever phenomenon you're interested in. But it's obviously going to not give you the capability of explaining why certain things happen. You can merely observe that things do happen, but given that you have basically no control over the observational environment for the most part, it's really not going to help you evaluate causal factors. Now, I did mention that researchers have limited control over observational measurement settings, but there's still different categories of observational research that give researchers more versus less control. So the most uncontrolled environment is going to be a naturalistic observation. So this is going to be when a researcher unobtrusively observes human or animal participants in their natural habitat. This is obviously going to be the best way to get the most, genuine behavior from your participants, particularly if they don't know that they're being watched. People act more genuine in their natural habitat. Getting people into a laboratory setting is always going to feel a little bit more contrived. So, if what you're trying to do is get a sense for how people or animals act under normal, natural circumstances, naturalistic observation is going to be the best strategy for that. It comes with the downside, though, that the researcher has the most limited control and understanding over the environment. Now, observational research can be done in a laboratory setting or a systematic laboratory setting, whereby the observation is done in a more tightly controlled laboratory setting. So, if let's say you have a laboratory with animal participants and you were merely taking a checklist of how often an animal exhibited a certain behavior, that would be laboratory based observational behavior. It's still a little bit more hands off, but the subject is going to be in the more controlled laboratory setting. An example of this for human research would be, let's say, like a sleep clinic, where a patient comes in seeking help for their sleep patterns. They would come into the laboratory setting and they would go to sleep, and the researchers would take observations of what happened while the patient was asleep. So it's observational research in which you're just observing what happens while the patient is asleep, but doing it in the laboratory versus just in a home setting allows a little bit more control. The researcher would have control over at least the environment of the lab itself. So, again, using this example of a sleep study, they could keep things like the temperature constant. They could make sure that any of the factors in place before the participant went to sleep were held constant to give them a better understanding of what was going on with someone's sleep. So, when you're doing laboratory based observational research, depending on the sort of scope of what you're interested in observing, you might take what's called a narrative record, where you basically have a start to finish, sort of minute by minute or hour by hour description of what happened the entire time the patient was being observed. This is, I guess, if you wanted to take a sort of more general assessment versus a checklist where you're only looking for very specific things to occur. So, again, this example of a sleep clinic, maybe the researchers were taking a checklist of how often the participant awoke in the nighttime, and they just were taking a tally of how often that specific behavior happened. So, obviously, the upside to observational research is that it's perhaps going to allow for more natural data collection. Your participants will be maybe slightly more comfortable, but of course, this depends naturalistic versus laboratory. The downside is that, again, it's a little bit harder to have tight control over a scenario when your participants are merely being observed. Now, if you're dealing with observational research, one other distinction is that the research can either be overt or covert. So, this gives the researcher just sort of more options of how to tailor their observational data collection. Overt observational research would be where the patients or the participants know that they are being observed and they're fully aware. This might be slightly harder to do in a laboratory setting, but it can obviously be done in a naturalistic type setting. The researcher can either make their presence known to the participants or they can keep it more covert or unknown. So, obviously, when you're dealing with covert research, you have an even higher amount of certainty that your participants are behaving naturally. But there's always going to be a downside to every upside. The downside might be that it's ethically dubious to take observations of participants when they're completely unaware of your presence. So basically, the moral of the story is that there's ups and downs to any measurement approach. It's just about deciding what works the best for your purposes. Then, lastly, we're going to talk about physiological measurement. So, this is going to be any biological based data collection. So, any brain scanning, heart rate assessments, hormonal assays, there's lots of different ways to collect physiological data. If we're talking about psychology, again, your specific physiological measurement approach is just going to depend on what you're interested in. If you're interested in the brain, then you would want to choose a brain scanning technique. If you're more interested in something like stress, then something like heart rate or hormonal fluctuations might work a little bit better for you. So, some Major examples of physiological measurement that's definitely used in the field of psychology, I mentioned this hormonal assessment. So, the way lots of hormonal assessments happen is through a spit swab. So, let's say you're a researcher who's interested in stress, and you know that the hormone cortisol spikes when an individual is feeling stressed. In the course of your research study, you could take these spit swabs at different time points throughout your study, and you would be able to analyze those spit swabs for when cortisol spiked. And this would give you an indication of when the participant was feeling stressed. A really important brain scanning technology that we rely on quite a bit these days is your functional magnetic resonance imaging. If you ever broke a knee or broke a bone, you might have received an MRI or a magnetic resonance image. It's kind of like an x ray, except it uses the magnetic properties of the soft tissue and the hard tissue of your body to give you a picture of your inside so you could visualize a broken bone. A functional magnetic resonance imaging technique, on the other hand, is where you can actually see patterns of blood flow. So, if you are using fMRI to measure brain activity, essentially, you could evaluate a proxy for brain activation based on where the blood flow in the brain is occurring over a course of time. You see that image to the right, that's a series of images from fMRI. Basically, as opposed to a static MRI image, it gives you a series of images that shows you how brain activity changed over time. The way this is done is, let's say you are a participant in an fMRI study, you would look like that dude over there to the left. You basically sit on this little gurney and get put into this giant tube that makes this really loud banging noise. And it's just a series of magnets that pick up on where the oxygenated blood is flowing throughout your brain. So, you might be thinking that physiological measurement bypasses all of the downsides that I mentioned for self report and observation, and that's true. People can't lie about their physiological levels. They can't fake their physiological levels, so you know it's going to be natural. So it definitely has some upsides that self report and observation doesn't have. And you might be thinking that sort of what's the downside? Isn't this sort of the answer to making psychology a lot more legit? Obviously, there's downsides still to physiological measurement, even before getting to the more conceptual one. One that I'll mention is that it's just exceedingly expensive, and it's a really hard technology to get your hands on. It costs millions and millions of dollars to acquire an MRI machine, an fMRI machine, and it takes millions of millions to operate an fMRI. So you need to have some pretty weighty grant money or have some contacts at a local hospital to be able to do this research. It's clearly out of the scope of what many younger or newer researchers would be able to accomplish. So the fact that it's sort of out of reach for many researchers, I would say that's a limitation. Another limitation I'm going to allude to by mentioning some actually really cool research from some researchers from NYU on a cool field called neuropolitics. So, neuropolitics is a niche area of neuroscience that looks at the brain correlates of political affiliation or political behavior. So, basically, does the brain experience any differences depending on your political identification or your political behavior? So here's an example of a really famous paper that Amodio came out with. Um, when was that? Over 10 years ago. So this particular paper, after it was published, did get a fair amount of mainstream attention, and it was kind of misinterpreted, and it was sort of taken the wrong way. The crux of this article, including some of the data depicted here to the right, but you could read from the abstract there on the left that on average, conservatives show more structured and persistent cognitive styles, whereas liberals are more responsive to informational complexity, ambiguity, and novelty. And overall, the researchers found that greater liberalism was associated with stronger conflict related anterior cingulate activity. You might be thinking that that all sounds completely confusing and incomprehensible to you, and I don't blame you. That is some pretty jargon heavy language, and it's pretty hard to understand. The basic gist, as far as I understand it, of this paper is that there's different ways that self identified conservatives versus liberals respond on a brain level too ambiguous versus certain information. And that is the extent of what the researchers concluded. Now, the way that this particular publication was reported on, though, obviously went far beyond that somewhat limited conclusion, basically saying, we found the liberal part of the brain or the conservative part of the brain, or that conservatives and liberals have different brains. Really, that goes too far in terms of making a conclusion based on the strength of this evidence. Now, this research is really cool and it is really interesting, and it does tell us something about how political identification does have some distinctive physiological correlates. But going beyond that to make those stronger conclusions, I think really distorts the strength of this research. So, coming to a conclusion that's sort of overblown from this really cool physiological research, I would say is somewhat of a limitation. Since physiological research is just more complicated and hard to understand, it means that it's a lot harder for non experts to be able to hash through what this research actually means. So, probably even more so than more basic self report and observational research, this kind of research can really be misinterpreted in some pretty drastic and damaging ways. So, overall, of the various measurement strategies, self report observation, and physiological, none are perfect. They all have their upsides and downsides, and it's just up to the researcher to decide when any given measurement strategy is appropriate.